Hello everyone, welcome to my Daisy. Today, let's talk about carcinoid tumor. So before we enter what exactly the carcinoid tumor is, let's talk briefly about stomach. This is the fundus of the stomach which secretes mucus, and comes the body of the stomach. Here you have principal glands. So we should know what exactly these principal glands are about. So inside the stomach layer you have a lot of glands, and here you have many kinds of cells like the parietal cells and all. Let's only talk about deep cells which are called as neuroendocrine cells. These neuroendocrine cells has G cells, which is produces gastrin. These G cells stimulate enterochromaffin cells. So we must all have heard about this enterochromaffin cells. So what exactly is this enterochromaffin cells? So these enterochromaffin cells, via serotonin, it releases increased amounts of serotonin, bradykinin, prostaglandin, substance P, and histamine, etc. So why are we talking about enterochromaffin cells? Because this carcinoid tumor which arises, this carcinoid tumor carcinoid tumor occurs with abnormal proliferations or multiplications of this neuroendocrine cells. So that is the reason it's called as neuroendocrine tumor. That is from the enterochromaffin cells. So where do we see this carcinoid tumor? Mainly in the GIT. So where exactly in the GIT? Small intestine, appendix, rectum, stomach. So most commonly it's seen in appendix. So we'll just know how does the people present with. So the clinical features are usually it is asymptomatic, so they don't have any symptoms, so it's very tough. So but sometime with abdomen pain, but mainly when does the symptoms occur, when does it start coming, is when the tumor spread from the stomach to the liver. It starts when it metastasizes. Metastasis is present from stomach to the liver. Only then we can see symptoms coming out. Starting off symptoms. But why? Because usually the amount of blood circulation goes from the stomach to the liver, and in the liver if there, because of its strong enzyme, it breaks down excess serotonin. It gets broken down. But as the serotonin itself, it's releasing in large amounts, some of it enters into the body and enters the bloodstream and causes symptoms. So what are the clinical features and symptoms because of increased serotonin levels? It shows mainly, first is cutaneous flushing when it enters the bloodstream, followed by diarrhea, vascular heart lesions, wheezing in the lung, like asthma. So these are the symptoms which shows. And then, so diagnosis, let's come about diagnosis. In the blood test, how do you do? So as we said, excess serotonin when it gets into the bloodstream, so increased serotonin levels are clearly seen. Apart from this, chromogranin A. What is this chromogranin A? It is secreted from tumor itself. Okay, these are the two blood tests which you do. And in the urine test, we take a 24-hour urine sample, 24-hour sample, and we get 5-HIAA. What is this? It is 5-hydroxyindole acetic acid, which is a byproduct of serotonin. Okay, this is in urine. And lastly, pathology. Pathologically, how do you diagnose this? Pathologically, we use immunohistochemistry staining, and it comes positive for chromogranin B. Alright, now let us come to the treatment part. So any tumor or anything itself, we first do conservative management, and if it doesn't get cured, then we go to surgery or radio chemotherapy. So first, conservative. What do we use here? We use interferon alpha, then everolimus, sunitinib. These are the drugs which are used for the conservative treatment that should be less than 2 centimeter. Apart from the somatostatin analog, chemo and radiotherapy is also used. But when do we actually go to surgical treatment? Surgical option, we go when it is not reducing with the chemotherapy. So 1 to 2 centimeter of the tumor, we do appendectomy. As I told you before, appendix is the most common site of occurrence. And more than 2 centimeter, we go for right hemicolectomy. Alright, if the liver itself, because of metastasis, if it is completely removed, then the patient must take iron for lifelong. So why does he have to take iron? Because the liver itself store iron in the form of hemosiderin and ferritin. Thank you, people. That's all for today. And if you like this video, please comment, like, and subscribe to Medici. Thank you.